Okay, my name is Alexis Durham. I'm going to be performing the head-to-toe assessment. I'm going to maintain a head-to-toe approach throughout. First, I'm going to introduce myself to the patient. Hello, my name is Alexis. I'm going to be performing a head-to-toe assessment on you today. Throughout the procedure, I'm going to be maintaining standard precautions. So first, I would perform hand hygiene by washing my hands or using an agency-approved gel. I'm always going to make sure that the patient is safe throughout the procedure, so making sure that their call bell is in reach, making sure the rails of the bed are up, or if we're in an office, that they're seated safely somewhere where I can assess them. I'm going to have all my supplies ready before I start the exam. I'm going to verify their band. I'm going to ask them to state their name and date of birth, or if they can't, I'll just verify the band. And I'm also going to make sure that any tubes and drains remain intact throughout the procedure. I'm going to use proper body mechanics, sitting when I can, and making sure that I don't strain myself while I'm doing the assessment. So first I'm going to observe the environment that the patient is in, making sure that the patient is in no apparent distress. And then I'm going to assess the vital signs, starting with temperature. I'd use a temperature probe for that, making sure it's in normal range. I'm going to take the pulse. You can either use the monitor or you can just feel the radial pulse, counting for a full minute. Count the respirations. You can place your hand gently on the patient's chest and feel their chest rise for 1 minute. Then I'm going to assess blood pressure, making sure that's in a normal range, pulse oximetry, and then perform a pain assessment, asking them to rate their pain on a scale of 0 to 10. Alright, so the next thing that I'm going to do, I'm going to go ahead and perform a general survey on the patient, basically looking at their overall appearance. We're looking for the color of their skin, their respiratory effort, making sure they're in no obvious distress. We're looking for personal hygiene, their mood, their posture, any obvious physical deformities, things of that nature. Next, I'm going to perform an assessment on the skin. So I'm basically going to have the patient sit in a relaxed position. I'm looking to see that the skin is warm, it's dry, it should be intact. I'm going to check the skin turgor by gently pinching an area of the skin to make sure that there's no tenting, and then looking for good capillary refill in the extremities, making sure that there's no cyanosis. Next, I'm going to move on to the head. So the hair should be supple. It should have an even distribution. It should be thick. It should be dry. Moving on to the scalp, you're looking to make sure that the scalp is intact, that there are no lesions, any pests such as lice, that there are no tenderness on any areas of the scalp. Moving on to the cranium, it should be normal cephalic, it should be of a normal shape and size, and again there should be no tenderness. Next, assessing the temporal artery. You can find that right here. On the side of the patient's head. It should be 2+ to 3+. It should not be bounding, and it should be palpable, should not be thready. Next, moving on to the mouth and throat. I'm looking at the lips. All areas of the mouth should be pink. Lips should be pink and dry, not overly dry and cracking, but you're looking for any excessive drooling as well. Next, I can ask the patient to open their mouth, and I can use a pen light here. To assess the tongue should be rough and pink. The mucous membranes should be pink and smooth around the tongue. Next, you're looking at the tonsils. There should be no discharge coming from those. The uvula, it should be midline in the mouth, and then upon asking the patient to say ah, you should see it rise symmetrically. Okay, next I'm going to perform an assessment on the eyes. You're going to note any assistive devices such as glasses or contact lenses with the patient. Moving on to the color, there should be the conjunctiva, which you can assess by pulling down on the lower lid. Should be pink and it should be moist. The sclera, the part around the iris, should be white, and that should also be moist. You're going to go ahead and test the reactivity of the pupils. You can use your pen light here. So you're going to shine a light. You're coming from the outside of the patient's field of vision moving to the center, and you're looking to see that the pupil that you're shining the light in contracts in response to the light, and then you're also testing for accommodation. So when this pupil contracts, this pupil should also contract. That's called accommodation again. So moving on to the ears. The external ears should be of equal alignment, the same on both sides of the head. There should be no lesions, discharge, or tenderness anywhere around the ears. Next, you can use an otoscope to visualize the tympanic membrane. So you would seat yourself beside the patient, use your otoscope, look directly into the ear at the tympanic membrane. It should be intact. It should be slightly gray and translucent. Moving on to the nose and sinuses, the external nose should be midline and there should be no crusting or drainage around the nose. The internal mucosa of the nose should be pink without lesions or polyps. You're looking at the septum of the nose, which should be midline. It should be intact. And then to assess the sinuses, you can gently percuss each of those sinuses to test for any tenderness. Alright, so the next part of my assessment is going to be the patient's neck. You're basically looking for symmetry on both sides of the neck, looking for freedom of movement. The patient should be able to move their neck freely from side to side, up and down. There should be no crepitus in the movement. Next, you're looking at the trachea. You want to make sure that that's midline, not deviated to either side. I'm going to palpate the carotid artery once on each side at a time to make sure that you don't stimulate the vagal nerve, which can affect the cardiac system. Next, I'm looking at the supraclavicular lymph nodes, which is just under the patient's maxilla. You should be able to feel those. You should not be able to feel those bilaterally. They should not be enlarged or swollen. Again, the range of motion, patient should be able to flex, extend, and rotate their neck without any pain. Moving on to the neurologic system, I'm going to assess the patient's mental status, making sure that they're alert and oriented, that they can follow commands. Some different cranial nerve tests that you can do. Again, looking at the pupils, looking at their reactivity and accommodation with your pen light. You can ask the patient to extend their tongue and move it side to side. You would ask the patient to smile, and you're looking for symmetry on each side of that smile. You can ask them to raise their eyebrows, making sure that they have appropriate strength to raise their eyebrows. Making sure that they're oriented to the situation, knowing where they are, why they're here, the situation. Next, moving to the upper extremities, we're looking for the CMS. It stands for circulation, movement, and sensation. Those three systems should be intact, so basically we're looking to make sure that the upper extremities have appropriate color. I'm going to check cap refill on each of the extremities, making sure that blood returns to the fingers within 3 seconds or less. Making sure that their temperature is appropriate, their skin should be warm and dry. Again, I'm going to test sensation on their upper extremities by gently touching the skin on their hand and asking them if they can feel that. Next, I'm going to assess joint mobility. The patient should be able to move all their joints on their upper extremities. Their wrists, their elbows should be able to flex, extend without any crepitus, any tenderness. There should be no nodules in the joint. Their range of motion should be a 0 to 3+. It should be symmetrical on both sides. Next, I'm going to move on to the anterior thorax. So I'm looking at the chest here. I want to make sure that the shape is symmetrical. I would ask the patient to recline at this time. I'm going to make sure that the skin is intact on the chest. There should be no rash, lesions such as hives. I'm going to look at their breathing. I'm going to look at the rate, the depth, the pattern. You're assessing for any distress here. Next, I'm going to take my stethoscope and listen to their breath sounds on all regions of the anterior chest. So, on all regions, bilaterally, making sure they're the same on all sides. Next, I would then auscultate the precordium over the point of maximum impulse. That is near the apex of the heart. I'm going to listen to the heartbeat for a full 60 seconds. And you're assessing here for any heaves, thrills, murmurs, all those things are abnormal. The rate of the heart should be between 60 and 100 beats per minute. There should be no murmurs, no gallops, rubs, anything of that nature. Next, I'm going to percuss the chest in all regions. So using my non-dominant hand, I'm going to place my palm on each region of the patient's chest and sharply percuss. Over the lung fields, there should be a resonant percussion sound, and over the heart, it should be dull. Next, I'm going to assess the carotid artery. On each side, it should be symmetrical. You shouldn't feel any bruits or thrills there. Next, I'm going to assess the patient's breast. I'm going to ask them to lie down flat and raise their arms above their head. I'm going to note the appearance of the nipples. I'm looking for any dimpling, any cracking in the skin. There shouldn't be any lesions or discharge. So starting at the nipple, I'm going to gently palpate in a circular motion, going from the nipple, working my way out, looking for any tenderness or any masses. Next, I'm going to palpate the axillary nodes. They should be non-tender and non-palpable. Moving on to the abdomen, I'm looking at the symmetry of the abdomen. It could be either rounded or flat, depending on the person's body size and shape. I'm looking to make sure that the skin is intact. I'm looking for any abnormal pulsations, any hernias around the umbilicus or in the inguinal region. I'm going to go ahead and auscultate bowel sounds in all 4 quadrants using my stethoscope, noting whether they are hypoactive or hyperactive. Next, I'm going to palpate all 4 quadrants, noting any tenderness or swelling. Next, I'm going to percuss the liver at I'm going to percuss the liver's margin at the level of the right midclavicular line. So I'm going to place my non-dominant hand just below the level of the ribs and sharply percuss. You should be able to hear some dullness over the liver, but it should not be abnormally distended. It should not extend more than 2 finger breadths down below the rib cage. Next, I'm going to palpate the spleen. It should be non-palpable. I can place my left hand across the patient, push up, and I should not be able to palpate the spleen here. Next, I'm going to assess the pulses. I'm looking at the aortic pulse. I can take both hands and place it just over the aorta, and I should be able to feel it pulsing, but it should not be greater than 3 centimeters. You're assessing for any abdominal aneurysms here. Next, I'm going to palpate the femoral pulses bilaterally. They should be present and they should be strong. Next, I'm going to assess the bladder. I'm going to palpate just over the symphysis pubis. I should not be feeling any distension. I'm going to assess the patient's urinary status. Their urine should be clear and yellow, and they should have no difficulty voiding. Next, I'm going to assess their bowel status. I'm going to ask the patient the date of their last bowel movement, and if we're taking a sample, then I'm going to make sure that it's soft and brown, making sure that it's not of any abnormal consistency or color. Next, I'm going to assess the lower extremities. The skin should be intact and slightly more pale in comparison to the rest of the body. Looking at the toenails, they should be white and smooth. I'm going to assess capillary refill on both feet, making sure that blood return takes less than 3 seconds. Next, I'm going to assess for any edema, which could indicate problems with the cardiovascular system. A lot of dependent edema will be seen around the ankles or calves. Next, I'm going to assess range of motion in the ankle. They should be able to flex, extend, and rotate both ankles. The knee should be able to flex and extend without any crepitus or any pain bilaterally. I'm going to assess the pulses. So the popliteal pulse should be palpable just behind the knee. Should be present bilaterally. Next, I'm going to do the posterior tibial and the dorsalis pedis, which is on the top. Next, I'm going to ask the patient to sit up while I assess the patellar reflex. So I would have them sit up with their knees hanging off the edge of a chair, and you can take the reflex hammer to elicit the patellar reflex. It should not be too strong or too weak. I'm going to assess the posterior thorax. So I'm going to ask the patient to sit up straight. I'm going to move behind the patient and place my fingers at the level of the thyroid. The borders should be palpable, but they should be non-tender and there should not be any masses. I'm looking at the skin on the patient's posterior thorax, basically making sure that both sides of the back are symmetrical. I can assess the patient's spine by having the patient stand and bend over at the level of the hip. Standing behind the patient, I can assess the spine for symmetry and looking for any deviation that would be present with scoliosis. I'm looking at both scapula, making sure that they're symmetrical bilaterally. Next, I'm going to auscultate the breath sounds, making sure that they are clear and resonant. So making sure to go over all lung fields from top to bottom. Again, they should be clear and resonant. Next, I'm going to look at the patient's buttocks. This is, especially in the elderly, it's important to make sure that there's no redness around the area if they are restricted to the bed. Last, I'm going to assess the genitalia. When you're assessing the genitalia, you're basically looking for any abnormalities such as redness, discharge. You want to make sure that the skin is intact and that there's no tenderness around the area. For males, you want to look for the presence of any inguinal hernias. Then lastly, assessing the rectum, you're looking to make sure that there's proper closure of the rectum, that there's no redness around the area, the skin should be intact, and then lastly, you want to look for the presence of any hemorrhoids or bleeding. And then in closure, you just want to make sure that you summarize all your findings, making note of any abnormal findings. You want to ask the patient if they have any questions at the end of the assessment, anything that they need to tell you that they might have thought of during the assessment. And then on your way out, you want to make sure to wash your hands, perform hand hygiene, put the room back the way it was before you came in, make sure that you give the patient their call bell, put their bedside table back near them so they can have their personal items in reach. And then provide for privacy by closing the door when you leave.